Can you hear me now? All right. Good afternoon. We'll go ahead and get started with the meeting. We'll start with the roll call.
Mr. Harding.
Here.
Dr. Hayes,
Here.
Dr. Lindemann,
Here.
Mr. Lynn, Ms. Rylander,
Here.
Ms. Van Rainey,
Here.
and Ms. Vincent.
Here. Okay, next item is to adopt the agenda.
I will move to adopt the agenda, and if somebody can tell me if that's
Sounds
not.
like it's on.
Okay.
Second.
All right. All approved?
Aye.
All not approved? Say aye. All right, motion carries. Next item on the agenda is the approval of the minutes.
I will move to approve the minutes.
Second.
All in favor, say aye.
Aye.
Opposed, same sign. So the approval of the minutes passes. Next is board president announcements, and he doesn't have any because he's not here. And next is the health officer presentation and report.
If you've had a chance to go through your packet, I want to highlight a few areas on page 9. Under the KPI progress, this is the key performance indicators for our Health First Indiana grants. And it may be a little bit confusing that you see KPI 1, 2, 3, and you're thinking, what is that? And each grant has key performance indicators that they need to meet each quarter of the grant cycle. The key performance indicator is different for each grant. So there's 7 key performance indicators that we're measuring. And so for one grant person, it may be the number of people, their goal of the number of people they're seeing. And for another, it may be the number of meals that they're delivering. And so the KPIs are different for each grant depending on what the grant is servicing. And this is basically to explain that's why you don't know what the KPIs are, because they're different for each grant. And you can see that collectively amongst all the organizations, the KPIs are above their goals. Most of them had goals of, either doubling what they had previously done in the year before, or increasing their volume by 20%, or something where they were servicing more people and more customers. So you can see that there were significant increases, and that all the average is 166.2%. So they're going above and beyond their goals. I want to point out that the lead environmental health team, the lead program, has been very, very busy. October was National Lead Month, and numbers up for the lead testing program are up significantly than what they have been in the past. Every month they go up. It's incredible work that they're doing. Our food services department has been incredibly busy. You saw that they did 55 inspections at Notre Dame Stadium during the Notre Dame Stanford game. So 3 people were very busy. We also had 2 members of the Department of Health attend a local public health symposium on October 30th, and Karen Teague was one of those individuals. She went with Jenna Rose down to Indianapolis, and they did the symposium, and they brought back a lot of information that was pertinent to their positions, and felt that that was good. The Foods Division is also looking at the food code. It's open to public hearing until December the 6th. And we're making our comments on it and submitting it for any changes, and also having our council look at that too. The other sorts of things that we've been seeing as the public health nurses are continuing to see the diseases. They've been getting a lot of calls about the mycoplasma pneumonia. They're fielding calls about whether to get vaccinated for it, things that people hear in the news like the Mpox and the dengue and the H1N1, the bird flu in Michigan, that we do get a fair number of calls about that and people looking into how they can prevent getting it themselves. Vital Records remains very, very busy. And again, the numbers are there. Does anybody have any questions about the reports? Yes.
I just have a quick question about the food services unit. Do we go out and are they required to get permits for like the Notre Dame games for like the houses that serve food?
I don't believe so, but let me double check with Carolyn. Is that a no? My no is correct.
Okay, why is that, I guess?
Because I think it's a private thing, that's a limited number of people and it's a private thing. Whereas in a public arena, there's a lot more people that could be affected and
I mean, I'm talking about like when they serve at the games, like all the houses usually have their little booths that they sell stuff and,
oh,
You mean like the fraternities and stuff?
yeah.
Oh, okay. So not like a private house, like out in
No, 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 no.
the
Like
neighborhoods or something.
the
dormitories.
Because that's what I thought you meant. So I think that's
houses, like the fraternity houses. that
But
you-
like the dormitories, like the hot dogs
Yeah,
and
yeah.
grilling
Sorry,
stations.
yeah. Brain fart.
So those are inspected by the campus food people, the food services at the campus. That's less for you, I guess. That's a good thing.
All of those, I mean, campus food services actually provides all the food and kids are just getting prepackaged stuff and selling it or pre-prepared stuff.
if
and
they
selling
grill
it, right?
stuff,
They
you
grill
know.
stuff.
Burgers and brats and
Okay, that's right.
Yeah, I feel they're just serving like, I don't know, like basketball game food is what I call it, but
It's
I
all
just didn't know
standardized.
if it was
Yeah.
like, because I was like, when I was there, I was like, I don't see any permits. I'm like, do we have to worry about that? But good to know, we don't. Okay.
that's a good thing. Any other questions about the report?
I just wanted to comment that you expanded the information for vital records that you're reporting on, and I thought that that was very helpful. It gives a better sense, at least to me, of what records are where the bulk of the records that you're dealing with and issuing really are.
And there will be
thank you.
one more category next month that we'll be adding and right now we're including paternities and genealogy, and next month we'll include court-ordered ones.
Okay,
Another,
okay.
the state state health department is trying to get everyone, all 92 counties on the same page with data tracking. And so every month we're going to be responsible for, they use a platform called RedCap where it keeps real-time data, keeps the numbers and adds it up as you go on your metrics within the department. So every department, health department in the state will have the same questions, the same metrics that they'll be following and answering on a monthly basis to track the money.
And I guess that leads me to another question. There are the requirements now that people can come into any county and file for a birth certificate and receive a birth certificate. But the whole process of getting that set up was not as smooth as it could be. How is that going? Or is it getting?
Even though it's a state law, it's not happening. Is
Okay.
Erica here?
Yeah.
I asked her the other day about
Uh-huh.
that, why it was not happening. And there are a lot of problems. One problem is that when you issue that certificate, when your vital records department issues a birth or a death certificate, they are certifying that it is accurate and true. And many times other counties don't have the correct spelling of a name. There's mistakes, there's different dates of birth. And it's really not sort of a safe thing for the clerks to do. So no counties are really giving other counties death because there's the database in downstate is just not reliable.
Oh, so we're still in kind of this holding pattern where nobody really can actually,
In a safe and reliable
yeah, or
fashion.
give a accurate,
Yeah, because
reliable.
if you certify it and you know, if it's a death
First-
and you try to certify it with an insurance company and something's spelled wrong or the date of birth is wrong, it's like, it just
Yeah.
is not a good thing.
Okay.
Any more discussion or questions? I'll entertain a motion to accept the health officer's presentation.
I will move to accept, the report.
Second,
All in favor, say aye.
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 All opposed, same sign. All right, moving on to new business. Item 2444, discussion and vote recommendation from the Health First Committee of the Board of Health to accept the 2025 RFPs.
I would like to just give you a quick overview of the process. So we started out with 50 applicants for the HFI money. So we had a really good, and everybody did a really, to be honest, a very good job of their applications. All of them were really good, and then there's a definite need in the community for the work that's being done. The way that the HFI funding is, I tell people it's not extra money because they think it's like extra money that we have in the health department, when in fact it's merely replacing grants, individual grants that we used to operate off of through the state and through the CDC and other, COVID grants. Now, all of that grant money has gone away and we get this money from the state and we're expected to do our programming, run the department, pay the employees, and then also run the programming that fills the community's needs. So it's not extra money, it's the money we now have to work with to do everything that we have always done. So we have the money, and we want to make sure that we're very good stewards of it so that we can hit as many lives in St. Joseph County, not just South Bend, not just Mishawaka, but, Lakeville, North Liberty, Walkerton, Osceola, areas that are not within the city limits. And so we take into consideration how many lives we can impact. And then we look at our pillars of health that we're trying to address, and they're listed here, access and linkage to clinical care, chronic disease prevention, infectious disease, maternal child health, school wellness, tobacco prevention. And some of the programming we actually sort of farm out, if you will, because we don't do it within our health department. So those examples would be, sexually transmitted diseases. Those we farm out. We don't handle those in-house. And those are also included in these grants. So what happened is we took the 50 applications that we had, looked them over. We had the subcommittee that you all selected, which was John Lynn, Dr. Lindeman, and Ellen Rylander, and they met with a subcommittee of the health department, which was me, Dr. Purushottam, Jenna Rose, and Mike Rubel. And so we would sit down and go through so we went through the first reading, then we picked the most promising ones. I believe it was I want to say 25, 23 maybe. And we looked at those. We brought those people in and actually had them give us a half-hour presentation. Sometimes it was longer than that, but we met with them individually, talked to them about their programming and what they wanted to do and what they saw the future of their programming being. We also looked at sustainability, how many lives did we hit? Do they have any other sources for programming, any other funding sources? So then after we heard the presentations, the committee and the health department went to the subcommittee. We met again, and we went through each one. It's a very long process, but we went through each one and talked about things that thought were good, and here's our budget and here's what we can and can't do. And so it was, to be honest, it was really kind of heartbreaking because there were other very good applicants and we couldn't fund all of them. And I hope they come back next year because, and that this program continues because it's really important in our community. There's a lot of good work being done. We ultimately landed on the ones that you see. The Angie's Dental Health Exchange is doing, I believe it's 65 sets of dentures. I didn't realize dentures are so expensive, but they are. And that's basically what we're paying for people who have no otherwise access. And Angie's has a nice program where they want you to do some community service to sort of earn those things that they do for you. And they have a lot of volunteer dentists that volunteer with that program. Portage Township is a food, trying to get healthier food and teach people how to cook, how to buy, how to get it cheaper. They've been very well attended. They've had standing room only classes. They hold them like at one roof. And they are very popular. The seniors really like this class, but they have families that go of an evening too. Real Services is directed more towards our seniors in the community, helping them again with eating healthy, chronic diseases. We help them with doing their flu shots in the fall. St. Joe Med Center has a couple of grants, but one of them is for chronic. They're starting a new chronic disease management program with community health workers, with nurses. They're doing a lot of education with people that have diabetes and high blood pressure, that they're going to be working with them. They have a dietitian. St. Margaret's House has a wonderful program. They are trying to do more in that regard by teaching, again, more healthy foods. They're going to have a dietitian help with preparing meals, teaching people how to cook, how to grow things. They're partnering with Unity Gardens. And again, it's sort of goes back to the mantra, if you want to feed somebody, teach them how to fish, sort of thing. And that's what we're doing with these. Same thing with Unity Gardens. They have a very popular program. They are expanding into an orchard, so now they'll be able to have fruit trees, and that's important too. They do some other things in the community, like they have Sunday morning pancakes and haircuts that they will do once a month. I think it's the second Sunday of the month. And so they're really offering, community where there's a need is open to anyone. Health Plus Indiana is doing all the STI testing and surveillance as well as treatment. They have wraparound services there to manage hepatitis C and help people get their hepatitis C drugs, which are incredibly expensive. And then NIMCHEN is located at the Olive Health Center, and they are also doing STI testing. People can go there for free. They prefer you make an appointment, but they'll take walk-ins. If they also have some wraparound services. So if somebody is pregnant, they will refer them off for prenatal care. So these two partners are covering our STI requirement, which is mandated by Indiana code. For maternal child health, we have St. Joe Med Center is starting a new maternal child program where they will be doing home visits. They have a nurse and a community health worker that are working together. They're working on teaching safe sleep to reduce maternal or fetal demise from unsafe sleep. And then Women's Care Center sees a large number of women just for pregnancy tests. But once they come, they can get education, they get signed up for parenting classes, they can get started with prenatal vitamins, they can get insurance navigation through RCHWs, and they can get referrals for prenatal care through RCHWs as well. The school wellness, the Cultivate Culinary School, does a wonderful program of recycling foods to send kids home with a backpack. And Play Like a Champion today is a great program to get kids more active, to be in organized sports like at school or a private sports club. It can be very cost prohibitive for a lot of kids. This is a program that's open to everybody through volunteer coaches. They want to get all kids involved in doing organized sports. And I think it's a great program. It'll be good for kids that can't do it through schools because it will also run in the summertime. But also for like kids that are not, that don't go to a traditional school, maybe they're homeschooled. These are programs that everybody can be involved in at no cost. Purdue Extension Service is teaching middle school kids how to plant a garden. They have a tower garden. They're all learning. They're excited. And that's a great age to teach them how to grow. They're doing like lettuce. Last year they had sandwiches with their lettuce in it. It was beautiful lettuce. But they're teaching kids how to do this. And they're also teaching teachers how to teach this so that the teachers can incorporate it maybe with their science curriculum or, health curriculum. But it's also a great program. The last one on the page is St. Joe Med Center with they're fulfilling the tobacco prevention, which we don't do in-house. They're fulfilling the vaping, smoking, chewing, that's going on in the community right now. We've talked to several leaders in the schools, even the parochial schools, private schools. They're seeing kids come in with this Zen, which is nicotine in a pouch, as young as 4th grade. So it's a problem everywhere. Hopefully that gives you an idea, but very, very, very great work out there in the community being done.
I have a question.
Yes, sir.
To the mental health awareness of Michiana, is there a particular targeted area that they're focusing on?
Yeah, do you want to speak to that, Jenna?
So I, off the top of my head, actually don't remember the targeted audience, but I can get that information to you, the targeted populations and things like that that they're focusing on. Off the top of my head, I can't remember.
It's a program to train more counselors specifically in maternal mental health to address the 4 stages of pregnancy, first trimester, second trimester, third trimester, postpartum. So dealing with a lot of postpartum depression. There aren't a lot of counselors in the community that deal specifically with pregnancy mental health crises, especially postpartum depression. But what they want to do is get interns. Last year they had somebody, this is the first time we're funding it, but last year they had an intern from Northwestern that came in. Most of these people are doing are either already in private practice for a couple years. They're trying to get people who haven't been out in practice more than 5 years, but that are not necessarily fresh out of school, but people who want to train and learn how to deal with maternal mental health, because we know that that does affect birth outcomes and also parenting outcomes, after the baby's here. So it's really to address, that's why it's in the maternal child health space, they're going to try and get these people trained so that they can address problems that occur. So they had somebody from Northwestern and somebody from IU Bloomington this last year training it. So this is their first year doing it. And it's sort of, they're housed at Roof 1, which is down by Riley High School. And they do see a lot of mental health stuff, and they are on a sliding scale for people who can't afford. They take clients that way too. So they're filling a need, and they're increasing hopefully the presence of people that can help mothers that are struggling.
Second question, Play Like a Champion today, is that a organization or is that focused on, again, what specific age groups and what type of activities and
So the,
many different athletic opportunities in the community regardless of your school corporation? And then you have a whole nother section of for-profit travel groups. And so where does this fit in?
this fits in for kids that can't afford to do that because it's free. And it's basically, they're using the money to like buy equipment, but they will, and it's middle school kids starting, I think, fourth or fifth grade maybe. They are going to provide organized, football, soccer, I think it's football, soccer, and baseball and basketball. So both male and female, but it's the kids that are falling through the cracks that either don't have the means, the financial means or transportation necessarily to get to after school activities, that want to do a program that doesn't cost money.
The city venue parks and arts has a number of programs already. And so
They partner with them.
they partner with them to identify maybe another tier of kids and families.
Yes, starting younger.
I'm trying to remember, just to butt in, I guess. I'm trying to remember, I think on when we were on the committee or earlier discussions, part of it was that it was kids who didn't have also didn't have opportunities at their schools for sports. So it was, they were too young, the school
Or they
didn't
didn't make,
provide.
they weren't
Yeah.
necessarily talented enough to make the team sort of thing.
Yeah, I can see the identification process very tight because there's so many activities that are awarded in Mishawaka. Each school corporation has things. The Penn system is different than South Penn system. And you have the parochial systems, the intercity Catholic leagues, you have a whole wide range. So I would be interested in knowing the selection process and how do you expand that? Because there are more children than there are programs for. And
They started the program. You can actually go online. It started, I believe it was in the Chicago suburbs for kids there. And they have other programs in the United States, and they wanted to expand it. They had the opportunity to expand it to South Bend. And so they were here, I believe, last year, but this year they were just looking for to expand the program even wider. And they are partnering with the Parks and Recreation Department. So the idea is to try and get kids more active is what we really want to do. But also, sometimes kids just need something to do too.
we have a lot of kids who can't afford anything. And so any opportunity is good, but there has to be some balance of affordability and what's the criteria and so on and so forth.
I don't think they turn anybody away. This is what they were saying.
You could up that budget by about $1 million and still have needs. So, thank you.
You bet. Thank you for asking. Any other questions?
I have a question. So there are like 16 pillars of health, but not all of them are met. Like they're all in what y'all selected. So how are those that are not met through these,
So the
how are they
six,
met elsewhere?
so the 16 pillars, they're not all enacted the first. The state chooses which ones that we enact. And so I think there's 7 or 8 that we were to focus on this year. And not all 16, but the state had us focus because this is just the second year of doing it. And the state wanted to focus on ratchet it down to, so that we could get this rolled out.
So the ones that we had listed at the meeting before, when we talked about which ones we're gonna meet, those are all met? Those have all been met?
And some of them are internally, like we do lead testing. That's an internal program.
Yeah, like I have trauma and injury prevention, immunization, lead, school health liaison, health-related areas of emergency, and food production that were not met specifically on the list you just gave us. So
Some of them are
those-
met inside. So another example for fall prevention, some people from the care division have gotten trained in fall prevention for geriatric people. And so they're going to be doing programming. They're going to be gearing up to do programming. So those are going to be internal. Immunizations are internal, school health liaisons internal, leads internal. I can't remember what else you said, but those are all from internal sources.
Any other questions? If not, I'll entertain a motion to pass item 2444. All in favor, say, I have a question.
right?
Oh, sorry, sorry. Someone make a motion, please.
I will move to accept the award. What am I specifically moving to do? Accept or recommend?
So, I mean, it's the committee's recommendations. You can approve the committee's recommendation, but it's actually the issuance of the grants is what we're doing, right? But we're awarding the grants to the,
We're awarding the grants, but does it have to go, do we award or just like the
We
commissioners award?
we award.
We award,
Mhm.
okay.
You could say to accept the 2025 RFPs.
So should I move to award the grants listed in the health office? I'm going to move to approve, to accept, or to award the grants listed in Dr. Migliori's November 20th, 2024 letter to the board. Good?
That'll work.
Okay.
Second.
You got the easy part.
All in favor, say aye.
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 Opposed, same sign. Okay,
And just to let you know, this will, once we get the contract signed, then it will go to the council and go to the commissioners too. So they will also be seeing this.
So they are going to approve, they both have to approve the contracts.
Correct.
Okay, okay.
okay, moving on to item 2445, discussion and vote, job description, environmental health specialist, septic coordinator, and environmental health specialist, water coordinator.
Hi, good evening. We are asking you to approve allowing us to have two of our environmental health specialist positions can be converted over to what we are terming environmental health specialist coordinator. We're taking, we have two staff, one in septic, one in water, that are essentially already doing the duties that we are proposing. And those duties are of a supervisory nature. They are essentially, for all functional purposes, in charge of other EHSs below them. So the kinds of duties that they're doing are they're training staff, they're reviewing staff work, assigning work to the staff, engaging in for what I would call troubleshooting, sort of a triaging complaints as they come in the door and assigning that work out. And then if those staff are running into issues, they're helping them to work through those issues. They are also organizing major projects in their respective area as well. And so this is a significant difference. They still will perform the usual EHS duties, but they will have these supervisory functions on top of the normal EHS positions. So we would like to recognize the work that they are doing, recognize that it is individual, it is unique. It is part of our quote unquote command structure. And then also compensate them with some additional pay. The pay for 2025, as we anticipate that this would be approved in time, we would like to start it on January 1st, would be $59,535 per year for these positions. And I'm happy to take questions that you may have.
You've actually answered my question, so thank you for that.
Sure, you're welcome.
So there is we have about 10 environmental health specialists, correct? So I'm curious about how many focus on septic, how many focus on water? So like 3 or 4 maybe, or?
Actually, Mark, would you mind commenting on that? Yes, thank you.
Okay.
Thanks.
So we have 3 or 4 total in septic and then 2 to 2.5 in water.
Okay.
And so they coordinate projects. We have the Jude Creek sampling that we sample that neighborhood every year. They take care of all that, reporting the results back to the neighbors, reviewing subdivision plan. Just, it's a lot of busy work that Brianna and I don't have time to do. But, we're still involved. They're not making the final decision. They do, help coordinate, bring it to us, and then we will make a final decision on it. But they're just, they really help our unit run. We couldn't do what we do without them. They're there every day, supervising their individual sections.
So they're kind of the go-to, the people who you're identifying for these roles are kind of the go-to people on each team in
Right.
terms of questions, trying to figure out kind of planning different projects and who does what and things of that
Exactly.
nature.
Yeah.
Okay.
So those positions you're talking about pulling out 1 of 4 for the septic and 1 of 2.5 for the water, and they're in charge basically of those other 1.5 and.
Well,
3.
they're not necessarily in charge of the staff, but say with the wellhead inspections, Kara will go through all of those and plan all the inspections for the month. And then, so that way her and Jessica can work that out. The same thing with David. I mean, with all the complaints and the different work that comes in, he'll reassign complaints that come in to staff to take care of that. They just kind of help run the unit for us.
So they're still working as environmental health specialists, going out, doing inspections, things like that. So
Yeah.
they're doing that work, but there's like a little extra that they have on the side to kind of coordinate
Yeah,
everybody.
they've just stepped up and have taken on additional duties, and we would like to recognize them for their hard work.
And do they tend to be individuals who've been here, I'm assuming, longer than the others? Been kind of in this role?
They both have been in their role for about 5 years now.
Thank you.
Any other questions? Okay.
We have a lot of history with our previous run on the health board with environmental. And that continues to be a concern as the county continues to expand services and now to the west. And one of the dilemmas we had was keeping up with personnel able to accommodate all of the new changes and different locations and new housing additions, and everywhere you turn in our county, there is seemingly more things happening with well and septic.
Mhm.
And our fear over the years has been, how do we keep up with that in terms of proceeding with that development at the same time, not overwhelming our people who can monitor those implementations and control. So I guess my concern is with the continued rapid growth of St. Joe County with those types of needs, do you foresee yourself adequately staffed to deal with what is presently here plus in the future? Or will we be looking at a need to modify these positions or add replacements for these positions to do something different? So
Okay,
what's
well-
your forecast, I guess?
Okay, so currently we have 2 EHS positions unfilled. One of them was for the property transfer position that the board approved. Because of the House Bill 1329, we can no longer charge for those. So it just, the whole property transfer program fell apart. So we didn't fill that position. And then Brianna, she's our lead risk assessor, and then she became assistant director, and we didn't fill her EHS position. But the one thing that's really different since you were on the board last is that the EHS salaries have gone up over $20,000. So we've been able to retain staff. I mean, everybody's experts in their area. It's nice to have staff that have been on everybody's been with us for 5 or 6 years or more. And so we're able to handle all the new stuff coming at us. With software and different tools, we're able to operate more efficiently. About 2 years ago, we purchased a ground penetrating radar. That's really helped out with some of the work that we're doing out there. So we're just getting more efficient with the staff as they're developing and becoming better EHSs.
Great work.
Thank you.
I have a question also that kind of segues from that one. So I think it was about a year ago, we had septic code, I think it was 51 that we
Mhm.
sent downstate, and because we're still currently following just the state regulations. Is that correct?
Yeah, our code has not been approved.
So a lot of what I'm seeing in this description, I guess, how is that affecting us right now? Like, how are we issuing permits? How is that? Because I don't want to say we don't have as many duties, but a lot of these duties they're not valid because we can't do them by the new code. So how,
No, it really hasn't changed much of our operation. We're still operating the same as we did. There's just a few changes, but nothing that's,
so we're still operating on that septic code 51 in our county.
well, we're following the state code, but what we do day in and day out really hasn't changed. The permitting process, everything's still the same.
Okay. Because I thought that we got rid of all that, like meaning the state put the kibosh on a lot of the regulations that we were instituting because of that code.
No, it hasn't been that sweeping of a change.
So we're still following our code.
No, we're following the state code. The law change wasn't, the county doesn't issue septic permits. The state code still requires the county to issue the septic permits. So the day-to-day process that Mark's team follows is what's set forth in the state code. Some of the requirements for issuing permits is different, but the
Right.
department still issues them. They still, the builders, the folks who are getting their septic tanks replaced, they still have to submit all the stuff to the health department, just like before. It still has to be reviewed. The criteria for how we review them and what we approve is different,
Right.
but everything else, the process is the same. Does that help?
Sort of, sort of. Just what I hear in the community, again, my background is my husband's a builder. That there has been still a lot of issues with getting septics approved.
I don't, I mean, he's more than happy to come in and sit down with us. We sat down with.
It's not him specifically.
We sat down with the
just
Home Builders
other-
Association and they said that the permit process is the fastest it's been in years, that there have been minimal complaints from the Home Builders Association members, and that overall they're pleased with things that were going on. We asked if there are any individual or specific complaints to please forward them on. We've gotten none. So
Okay,
if he's
I'll
got
call him.
any, once again, happy to take them, happy to talk, happy to sit down with them. But it's an open invitation and I mean, it's been open for months now and we've gotten zero.
I just wanted to clarify, I didn't know where we were at on that, so, because I know we've had this huge meeting, member, and went through all that.
Mhm.
So we sent it downstate. They did not approve it, or they sent something back, or what, where are we at with that, I
I
guess?
think it's still sitting down there waiting to be reviewed.
Wow, okay. Got it.
Any other questions?
Actually, I hope I'm not getting technical. I just want to make sure that I understand this correctly or if it's worded correctly. For the septic on page 3, there's a line, like at least on my printout, it's like the 5th line down, proctors and grades exams for renewal of St. Joseph County septic system contractors. And, I think maybe, I don't know if I asked about this, but if I'm reading this right, is it the contractors, are they getting like a license or from the county to be a contractor, or is that what the exam is for?
Yes, they have to pass an exam
Okay,
to register with us.
okay. Should it say something like proctors and grades exams for renewal of St. Joseph County septic system contractor licenses? Something like that, would that? Am I thinking about that correctly? I just feel like there's a word missing, like license or permit or something.
Certification.
Certification, yeah.
Yeah, I think, because we're switching to new software, so everything, it's, yeah, so it would be, I think it would be considered a license. There's licenses, what we used to call permits, the new software so we're changing some of that terminology, but they would be exams for not just renewals, but also for new installers as well.
Okay,
So I think that would cover any contractor coming in, whether it's for a renewal or a new one.
okay. So should we not have renewal in there? Maybe I'm not following. Should we?
You could say proctors and grades exams for St. Joe County septic system contractors license.
Yeah.
Oh,
Yeah.
Sorry to jump in. I just want to point out, I would not include the word license in discussions with the State Department of Health regarding our ordinance and various changes. When you start talking about licensing and registration, all that, the words get very technical and it can trigger different things. I think for the intents and purposes of the job description, leaving it kind of broader is probably in our best interest.
okay. Okay, that's good to know. I just wondered if that needed to be reworded, but if you're saying a little vague is better, then. Okay.
All right, I'm going to entertain a motion to accept item 2445, which is for the job description.
I move to accept item 2445.
Second. All in favor, say aye.
Aye.
All opposed, same sign. Okay. The next item is item 2446, which is the actual budget for compensation of the environmental health specialist septic coordinator and environmental health specialist water coordinator.
Maybe, was it just me? Did we not get? Oh, okay, I didn't see
Yeah.
that. Okay.
Yes, we're proposing that the salary for this position is $59,535 starting January 1st.
And that's up from what salary?
This salary as we had it previously was 57,330.
Okay, and then whatever benefits, taxes, everything else that needs
Correct.
to be adjusted. Okay. Thank you. That's probably the substantive information that we need to know. Okay.
Sure.
I'll entertain a motion to accept item 2446 for the budget.
So moved.
Second.
All in favor, say aye.
Aye.
All opposed, same sign.
Thank you.
Next item on the agenda is grant requests. There's none listed. Next is old business and nothing listed there. And then the final item is the public comment. I'll go ahead and read that. At regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may only speak once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during open sessions of the Board of Health. The board president may interrupt, warn, or terminate a person's statement if the statement becomes personally directed, abusive, obscene, or inflammatory. Is there?
Cynthia Heckman Davis.
Good evening, board. I'm thinking ahead to next year's budget. And I've also been, since the election, searching for common ground with RFK Jr., who is likely to be the next director of the Department of Health and Human Services. I agree with him that chronic disease is a big problem and that diet plays a role in chronic disease. Regarding immunizations, he and I strongly disagree. I consider vaccines to be God-given scientific knowledge that has saved countless numbers of lives. From 2000 to 2023, measles vaccination alone prevented more than 60 million deaths worldwide. It isn't just lives saved, though, it's also money. In the last year, 95% of people hospitalized in the US for COVID-19 weren't up to date on their vaccine. And people who skipped the flu shot were twice as likely to need medical care for influenza. Back to measles. Measles cases rose 20% last year in our world due to poverty and conflict interrupting vaccination programs. Measles is highly contagious with a mortality rate of about 1%. It kills about 1% of the kids that get it. Measles was found in 30 of our United States this past year, with more than 4 times the number of cases from 2023. Because of our previously very good vaccination record, I'm sure that Drs. Hall and Lindemann have only seen the Koplik spots of measles in pictures. I've never seen a person with lockjaw because of immunizations for tetanus. I bring up the topic of vaccines because vaccines are regulated by the states and not by the Department of Health and Human Services. Our Indiana General Assembly is likely to cut funds for public health next year, the next budget cycle of 2 years. And you, as the board overseeing our Department of Health, will be asked to do more with less. Please keep vaccination availability at the top of your list. Vaccines save lives and money. Thank you.
Thank you. Any other? All right, so the next item on the agenda is the time and place of the next meeting, which will be the 18th at 4:30 here. I will take a motion for adjournment.
I move to adjourn.
Second.
All in favor, say aye.
Aye.
Opposed, same sign. All right. Thank you, everyone. Thanks for putting up with me.
Great, thank you.
You know what? I forgot. Thanks, tell